1 in 4 people are going to be diagnosed with cancer. The fact that fear is so prevalent too with the cancer diagnosis and what it ultimately looks like, having had a cancer diagnosis myself too, is part of the reason that I'm very passionate about this and look at what we can do in the cancer care journey for patients. Certainly, it's getting over the hump of the education and the complexity because it is going to have a lot of different treatment options and modalities around it. We're getting to a point in a place too where ChatGPT and the ability for AI to even be a backstop. Hey, this is my cancer diagnosis. I'm going to upload all of my information and see what those treatment paths are. You're getting patients that are doing that more and more. So we're in this very, very quick evolving type of space.
When I started inspiring women, I had one clear mission: to advance the next generation of women leaders. This show is for you. Whether you're climbing the corporate ladder, building your own business, or navigating the complex world of healthcare leadership. That's why I'm asking you to please take a few minutes and fill out our quick 5 question survey. Your feedback will help shape the future of the show: what topics we cover, which guests we feature, and how we can best support your leadership goals. Visit inspiringwomen.show/survey to share your thoughts. That's inspiringwomen.show/survey. Your voice matters, and I can't wait to hear from you. Now, on to today's guest. This is Inspiring Women. I'm Lori McGraw, and today I am speaking with Ann Stadjuhar, and she is the newly appointed Chief Growth Officer for Reimagine Care, which is a platform seeking to revolutionize cancer care with digital health solutions. Ann is 20 years veteran in innovation in digital health, started off in women's health, has been at the advisory board and others. And thank you for being on Inspiring Women.
It's great to be here.
Well, it's like we've already been having some fun. You've gotten your dog out of the way, and we'll see if that like stays true. You've shown me your super cool innovation meta glasses, and so I have a little bit of like FOMO that I just have like regular old readers here. So
You can get readers put into them. It's
uh,
great.
the great just keeps on coming. And why don't we get started with why Reimagine Care? You have many choices in terms of things that you could have done next, and you chose Reimagine Care. I love this company. Why did you choose it?
I've had the good fortune of being at the right place at the right time with a few organizations before, and like that lightning in a bottle scenario and those moments don't come along that often. We're at a place where AI plus human in the loop, and having a platform that is doing both is incredibly exciting. And I think we're finally at a point of getting through that adoption curve and people being ready for this. So I'm very excited on that front. But I ran into Reimagine Care when I was working with the Cancer X Accelerator,
Hmm.
and they were part of the first cohort. And having seen hundreds of pitches and having a little bit of that opportunity to identify an organization that I felt had the right ingredients to be there, and great leadership with Dan, great technology platform, again, right place, right time scenario. I kind of jumped in with both feet when the opportunity arose. I had some experience with Martin Ventures and some of their portfolio and organizations. And I just thought, you know what, this is a good time for me to exit out of consulting, which I had been doing for the past few years, and jump back into a reality of looking for an opportunity for a company that might be a rocket ship.
Yeah, well, I am hopeful for you because you're doing some interesting things. I want to talk about those things, but I actually want to start, Anne, with your work in cancer. When we talk about cancer, it is a word that takes everyone's breath away. There is probably no person that doesn't have some experience with cancer, whether they've had it, have had a loved one, or have a loved one who is dealing with it, maybe as a caregiver or something else. And I think there's a lot to be excited about in the area of AI. We certainly know that therapies that are out there, precision medicine in the space of cancer can be really exciting. But you're on the care delivery part of cancer. So just that side, first of all, why is cancer so complex for somebody who is dealing with a cancer journey? And then what is possible with the types of things that you're thinking about?
Certainly that personalization and the reality, 1 in 4 people are going to be diagnosed with cancer. The fact that fear is so prevalent too with the cancer diagnosis and, what it ultimately looks like, having had a cancer diagnosis myself too, is part of the reason that I'm very passionate about this and look at what we can do in the cancer care journey for patients. Certainly, it's getting over the hump of the education and the complexity because it is going to have a lot of different treatment options and modalities around it. Even having experienced it, myself and looking at who my surgeon was going to be, I had the good fortune of knowing case volumes. I had the good fortune of having an inside track on some of this and being able to create a relationship with my gynonc too, because I was already in the healthcare space. I was working for Optum too, and just the conversations that we had that led to um, a bigger opportunity for myself just because I was educated. And I think that's, unfortunately one of the shortcomings is the patient doesn't know. And there's things like case volumes, there's things like the multiple types of procedures or think surgeries or things that could be done and staying on latest and greatest and cutting edge. We're getting to a point in a place too where ChatGPT and the ability for AI to even be a backstop. Hey, this is my cancer diagnosis. I'm going to upload all of my information and see what those treatment paths are. You're getting patients that are doing that more and more. So we're in this very, very quick evolving type of space that is happening, personalized treatments down to your genomic, DNA and everything like that is precision medicine is a reality. So it is complex. A lot of these options are out there. How do you stay on top of them and be the most educated? And to me, I look at it in having been in healthcare for, over 20 plus years and just cancer for me is kind of like my capstone almost in the place to be, as I look at like not to say the end of my career or anything like that, but why not tackle probably the most complex,
So big. Yeah.
so big, so many opportunities for problems to solve. Whether it is the treatments, the clinical trials, I think one of the most disturbing things right now is site of care and the
Mhm.
cost associated with site of care. And that
Yeah, but
opportunity.
before we even talk about like site of care and some of the specifics, I mean, first of all, Anne, I'm sorry that you have had to deal with a cancer diagnosis that is difficult. I'd just like to talk a little bit about the experience. So, knowing what you know, having all of that expertise, what was as much as you're comfortable sharing, the journey of even being knowledgeable as somebody as a person with cancer, like, why is it so complex to navigate the system of getting treatment and the right information?
I mean, I do think there is, this dirty word often too that is steerage, right? And the reality of what your health plan will cover and where you get sent and what happens to you and the claims process and the denial process that is incredibly burdensome. And the
Mhm.
patient not even understanding or comprehending, what might be going on with coverage for treatments and what is even, or who might even be the best person to manage your specific care and finding that usually when you are told you have the big C, your jaw just drops and you just
Yep.
fall into, okay, what do I do now? And the feeling overwhelmed. I think for some patients, for someone like me, it's the scurrying of like, how fast can I go with how much data I know and
Yeah.
what I can go after. So I think some people handle it oftentimes differently. And I look at it for the people who just don't know and just kind of get shuttled down the path and don't do their research, don't do a little bit more of the digging. I had an uncle that passed that literally was getting treatment in New Mexico. And by the time he got to MD Anderson in Houston, it was too late. He was no longer operable, but he had probably received inadequate treatment with his physician in a
Yep.
small rural community for way too long. And just
Yeah,
do
and I think it is so hard for people to know. It's such a big word, takes your breath away. It is something that the entire all of the stakeholders, your family, the others who are suddenly a part of your journey in a different way than, really big things like surgery or whatnot can be. And I had Dr. Karen Knudsen, previous president of the American Cancer Society, on the pod, and she was just talking about some of like the what's happening in cancer now. On the optimistic side, or what we can be excited about, is just there's so much evidence that if we just applied the aggregate best practices, we would make such significant advancement. But that put that against some of the realities of we're seeing, I think it's up to like 25 cancers where the age of where the onset of these cancers are, it's happening to people in their 20s, their 30s. It used to be sort of like in the 50s, but it's at younger ages. And in particular, women are they're just seemingly being hit at younger and younger ages. So we're looking at a landscape that needs solutions, and particularly needs solutions that really put the patient at the center to give them the right information, the right care for when they need it. So you went to Reimagine for a reason. Give us a little bit about why you're so excited about what you're doing there.
I think the ability to manage patients on treatment and the ability to manage symptoms remotely and in the time, you're outside of the practice in the office, is incredibly key because obviously you're not going to be with your doctor 24/7. The ability to get questions answered, know that you have a resource around the clock because the worst part of cancer is the wait and just
Hmm.
waiting and waiting to hear and waiting to talk to someone that is involved in your care, and we can be there 24/7 to essentially even understand whether or not there may be SDOH needs. And hey, I need a ride to treatment. I need someone to watch my dog so I
Hmm.
can make it to treatment. I have some issues paying my electric bill. Like those types of things come up, and they can come up very comfortably sometimes. And certainly the extensions that we make to have with the patient, but you know what's interesting is there's human touch and there's always the inability to sometimes have a difficult conversation of like, I need help.
Hmm.
I'm suffering. Um, and sometimes people are honestly, and I think we've become somewhat desensitized, but they're comfortable with the bot and they will
Hmm.
tell, essentially REMI and our AI solution that they're having these challenges and more readily tell people they're having these challenges. And we can escalate it quickly and try to get them the resources that they need. And some of that comes from even mental health scenarios or SDOH scenarios, but there is a lot going on besides just the care management and the symptoms too that we can also help triage and essentially get the patient cover for. But having a companion during your cancer journey, whether it's AI or a human, it can't be a human all the time. But that's
Yep.
what I think exciting about Reimagine Care is that not feeling alone and getting answers quickly is something that you definitely want when you're facing a cancer diagnosis and treatment.
We'll be right back with more inspiring women after we take a quick break. Hey, this is Lori. Did you know that we have a newsletter with exclusive insights and resources to help inspiring women like you? It's completely free. You can sign up at inspiringwomen.show. Be sure to check it out, and thank you for tuning in. Okay, back to the show. And so, Anne, you have done some pretty impressive things over the course of your career, and whether it's been in consulting or at Optum or the advisory group, or like, standing up big centers, during the course of the pandemic. Now you're tackling something quite large and an evolving space in terms of what's actually happening with people with cancer. And if if this is your capstone, your North Star of where you're taking all of that great learning and what you've done before to what you're doing now, what has prepared you to tackle something this challenging? What were those moments that you felt, really taught you what you feel very confident and comfortable with in terms of what you're tackling now?
I think I've done everything from individual launching of like pharmaceutical drugs to as well as devices to doctors at that level to scaling large CRMs and platforms and full integrations and population health tools, ratings, stars ratings for hospitals at healthcare, online appointment scheduling. The fact that we still can't quite figure out online appointment scheduling
What?
is, I know, is somewhat tragic. Certainly understanding, I think, all of the systems and the levers that are in place. What's hard is the regulatory, the interoperability, the realities of workflow challenges, and everything that I've done, I've been able to have a line of sight into that and work through it and know what the obstacles are because there's unfortunately so many of them in healthcare. I think it's more of like the ability to truly run the gauntlet that is our healthcare system, and it's just comes from the experience of having done all that and thinking of all the boxes that you have to check, all of
Yep.
the table stakes, all of the requirements, and knowing what you're up against to get some things done, and the adoption curve and the time that it takes it. I've certainly seen quite a bit of that and seen it all as it relates. And we're getting into a new area with regulatory. I think we don't know. It's the Wild West with AI.
Yep.
But I think having some basis in some other frameworks of FDA clearance, having worked through some scenarios with 510(k) and software as a medical device, and some of the work that I've done over the past few years that will help, I think, in being able to on ramp, what will become an AI solution downstream. And it's got to go through the regulatory process more and more so later. But we're very much so human in the loop. I think humans will be in the loop for a while, but ultimately, I think the goal is, how I think we're going to need to get to the reality because there's just going to be a shortage of healthcare workers.
Yeah, we're seeing that in so many different places. You talked about wait times and just like, how on cancer journeys, like some of the challenge can oftentimes be just the wait for the next thing. And sometimes those waits are finding the right physician or clinician or place that you need to go to. So, Anne, with all that experience, sort of like, having you be up for the task, up for the job, then I guess as we think about, what's ahead, do you feel like you're moving faster? Because you mentioned a lot of obstacles. Are you able to move fast, or are you just clearer about like what the obstacles are and how to tackle them? I'm just curious as to how you're thinking about it and approaching it.
I think, for me, it's a lot of clearer on the obstacles that need to be tackled and checking the boxes and just having those conversations that it's not, it's, just a known entity that we've got to do these certain things and making it shorter because you know what you know rather than waiting to learn what you don't know.
Yeah.
So that certainly helps. I mean, honestly, the struggle with health systems and the sales cycle and the time that it takes for adoption and the pilot, scenario where you can
Yeah.
get in purgatory and stuck. Having experience with all of those things and just having a plan for how that gets operated around and run through is certainly what I'm hoping to help shorten in the learning cycle and the sales cycles for us getting better and faster adoption because we need that. I mean, 18 months to get adopted on average or even get a pilot contract signed by a health system is just incredibly painful, and it's
Eternity.
eternity for the patient. It's an eternity for the providers who are spending pajama time and their weekends and evenings doing all this additional work. So how can we make things go faster is definitely one of my most important initiatives.
Yeah, I hear it. I hear it. So, Anne, when I speak to inspiring women, I like to know, I find when people are as accomplished as you are, that they're usually also like focused on learning new things. So, what are you learning these days?
I mean, for me, stay curious is definitely my motto, and it is using as much AI as possible. I mean, I remember when ChatGPT got introduced and like where we're at now from even where I was at then in the proficiency. It's multiplying your own capability times four in a lot of cases, and what you can use it for, the different use cases, the you know prompts and some of the expertise really being bionic almost in some of the work you do when
Hence
I'm
the meta
yes, the
glasses.
meta glasses. I also use a tool called Plod that helps me record. And again, I was mentioning this is like menopause, right? My memory is not as good as it once was. But getting the names, getting the speakers, getting the notes, getting the follow-ups, getting all of these things, and being as efficient as possible has always been like that is one of the biggest things that I'm learning right now. Having a 20-year-old daughter as well helps me in learning like the things that she's looking at and she's using, and she's in college, and the way that they're educating our children now and like what she's learning and how to use it is has been fascinating for me. And cancer, healthcare, it it's endless. It's part of
Yeah.
the reason that I am in healthcare is because there will never be a mastery of it. There will never be a an end to what I can learn, what I can know. So I think anybody in healthcare kind of feels that as well.
There's a lot of energy and I hope optimism in those comments. And as we close out this Inspiring Women conversation, I always love to hear from leaders like you as sort of like the next generation of leaders that are out there. What's the advice you're giving to them?
Honestly, stay curious, stay true to yourself for sure, and what you're passionate about, and what you care about, and know what you care about. Like I think sometimes this younger generation, to me, sometimes they feel a little more apathetic or like lost, and they think they're trying to find their passion, and it's really important for that motivation. And staying motivated and optimistic, like you said, and the reality of, what we're facing in AI and not knowing and learning, I would say experience and in-person experience is so important. Relationships are so important with people face to face, not just texting, not just on the phone,
Yeah.
doing everything digitally. I think EQ is one of the things that we're going to need more than ever. And, it's important to understand who you are, but also having that EQ to care about what other people think and who other people are is really what makes the world go round.
Well, Anne, I think there's a cocktail hour in our future together. That's all I can say about that. This has been an excellent Inspiring Women conversation. I've been speaking with Anne Stadjuhar, and Anne, thank you so much.
Thank you very much for having me.
If you enjoy the show, please leave a 5-star review. Thanks for listening to today's episode.